everyone, I'm Dr. Chinyere A. Ugoji, MD, MBA. With interest in healthcare, education, leadership, and public health and graduate medical education with application through the Electronic Residency Application Service 2015, and participants in the American Medical Association mock interview session, and welcoming you to Dr. Chikito Mentoring Iridescence Educational Collaborative Global Ustream YouTube show. I would like to share these quotes with you. At each and every juncture of our country, somebody has been audacious enough to say, we could do better, and most often than not, it's the young people who have done it. President Barack Obama, February 2nd, 2007. This program will mentor and cultivate young leaders of today and tomorrow. And I am proud that they will have this opportunity to serve. I look forward to working with those who are selected to participate. And I want to commend all who apply for their desire to help through public service to forge a brighter future. President Barack Obama, May 22nd, 2014, on the White House internship. Education is the key to success for so many kids, and my goal specifically is to reach out directly to young people and encourage them to take charge of their futures and pursue and complete an education beyond high school. First Lady Michelle Obama, January 16, 2014. Education is indispensable to the success of every individual and is a motivating factor behind my graduate medical education curriculum review. An interest in the Reach Higher initiative by the First Lady Michelle Obama, inspired by this quote by the First Lady Michelle Obama, and a determination to focus on education. Dr. Chinyere A. Ugoji, MD, MBA, October 25th, 2014. Today we'll be discussing the commonly encountered graduate medical education questions encountered on the expedition for the perfect fit for the graduate medical education goals. The graduate medical education question for the interviewer, which could be the program director, the faculty member, the resident, the medical student, or the staff, would be what programs exist for resident education, example, lectures, journals, clubs, ground rounds, board review courses. I would like to share some of these programs that I've experienced in my career. Atlanta Medical Center, Atlanta, Georgia, and Crawford Long Hospital, Atlanta, Georgia, Henry Ford Internal Medicine Residency Program, Detroit, Michigan, Southern Illinois University Family Medicine Residency Program, Springfield, Illinois, Harris Fort Worth Methodist Hospital, Fort Worth, Texas, Hornsview Family Medicine Residency Program, and St. Elizabeth and St. Mary Family Medicine Residency Program offers didactic sessions with common topics including acute renal failure, pulmonary tuberculosis, diabetes, endarterectomy versus stenting in patients with symptomatic severe carotid stenosis, which I presented at Southern Illinois University Family Medicine Residency Program, and which can be found on my curriculum detail. Community acquired pneumonia in medical school at Atlanta Medical Center, Atlanta, Georgia, childhood leukemias at Atlanta Medical Center, Atlanta, Georgia, the role of sexually transmitted diseases in human immunodeficiency virus, acquired immunodeficiency disease infection, and various other topics. The question for the interviewee would be, how do you handle challenges? And my answer to that would be, I love challenges, and I emerge mature and resilient after challenges, utilizing hard work, professional resources, and collaborative teamwork. Now next we talk about the overview of the patient encounter as part of a project completed by Dr. Chiki for mentoring Iridescen's educational global youth stream show. And we will start by talking about the opening of the encounter. The typical patient encounter starts with the patient presenting to the office or to the clinic, the outpatient department, or the inpatient department, which could be the hospital, the acute care center, or the emergency department, and being checked in by the office staff, which include the auxiliary staff, and also having their vital signs measured and recorded, and then being put into a room. And then your job as a physician or as a medical student would be to go to the patient's room, grab the chart, or go to the computer and look at the patient's chief complaints, the patient's vital signs, the patient's past medical history, past records, and then go to the patient's room, knock on the door, which is courtesy, which is courteous, and then go into the room and introduce yourself, which could be by shaking their hands or patting their shoulder if they are acutely sick, or just saying, "Hi, Mr. A. Hello, I'm Dr. Gorgi. It's nice to meet you. I'd like to ask you some questions today. Some questions and examine you today." Another question you can also ask would be, "How can I help you today?" Another question you can also ask would be, "What brought you to the hospital or clinic today?" Another question you can also ask would be, "What made you come in today?" Now, one of the symptoms that patients present with is pain, and this could be due to various pathophysiology, and we'll talk about the differentials for pain coming up soon. So you can ask them, "Do you have pain?" You can ask them, "When did it start?" You can also ask them, "How long have you had this pain?" You can also ask them, "How long does it last?" You can also ask them, "How often does it come on?" And then you can also ask them, "Where do you feel the pain?" And then you can also ask them to show you where the pain is. You can ask them, "Can you show me exactly where it is?" Ask them to point to the pain. And then also you can also ask them, "Does the pain travel anywhere?" And then you can also ask them, "What is the pain like?" Or you can also ask them, "Can you describe the pain for me?" Or you can also ask them, "Is it sharp, dull, burning, pulsating, cramping, or pressure-like?" You can also ask them, "Is it constant or does it come and go?" You can also ask them, on a scale of 1 to 10, with 10 being the worst, how would you rate your pain? You can also ask them, "What brings the pain on?" And then also ask them, "Do you know what causes the pain to start?" Or ask them, "Does anything make the pain better?" That's inquiring for alleviating factors. Does anything make it worse? Would be inquiring for exacerbating factors. Have you had similar pain before? That would be inquiring for previous episodes. Now for nursing, you can ask them, "Do you feel nauseated?" Another common language that patients typically would be able to give you an answer to would be, "Do you feel sick to your stomach?" And then also you can also ask them vomiting. Did you vomit? Or you can ask them, "Did you throw up?" Or you can also ask them, "What color was the vomit?" Normally it could be food products, it could be bowel tinged. Or you can also ask them, "Did you see any blood in it?" For cough, which is the next symptom that we are going to talk about. We talked about pain, talked about nausea and vomiting. You can ask them, "Do you have a cough?" You can also ask them when did it start. You can also ask them how often do they cough. And then you can also ask them, do you bring up any phlegm with your cough, or is it dry? You can also ask them, does anything come up when you cough? What color is it? Is it yellow? Is it green, indicating an infectious etiology? Is it blood tinged, indicating malignancy or tuberculosis? And then is there any blood in it? That's the question that we just talked about right now. Then can you estimate the amount of the phlegm? Teaspoon, tablespoon, cupful. Does anything make it better? Would be another question you can also ask. Does anything make it worse? Then we talk about headache. Do you get headaches? Tell me what happens before doing and after your headaches. That's inquiring for auras. And then when do your headaches start? How often do you get them? When your headache starts, how long does it last? Can you show me exactly where you feel the headache? Probably asking them to point to the headache. Is it a frontal headache? Is it temporal? Or is it at the back of your head? What causes the headache to start? Some patients have light as a precipitating factor. Some patients have stress as a precipitating factors. And then do you have headaches at certain times of the day? Would be another question you could also ask. Do your headaches wake you up at night? What makes the headaches worse? Would be asking for exacerbating factors. What makes it better? Would be asking for alleviating factors. Can you describe the headache for me, please? Is it sharp, dull, pulsating, pounding, or pressure-like? Do you notice any weakness or numbness before, during, or after the headaches? Would be some associated factors that typically come up with the headache. Do you feel nauseated? Do you vomit? Do you notice any fever or stiffness with your headaches? So next thing we'll talk about will be the symptom of fever. And you can ask the patient, do you have a fever? Do you have chills? Do you have night sweats? Do you sweat at night? How high is your fever? That's asking them if they measured the fever and what the temperature was. Shortness of breath, you can also ask them, do you get short of breath? Do you get short of breath when you're climbing stairs? How many steps can you climb before you get short of breath? When did it start? When do you feel short of breath? What makes it worse? What makes it better? Do you wake up at night short of breath? Do you have to prop yourself up on pillows in order to sleep at night? How many? Have you been wheezing? How far do you walk on level ground before you have shortness of breath? Have you noticed any fluid retentions around your ankles? For urinary symptoms, you can ask them, has there been any change in your urinary habits? Do you have any pain or burning during urination? Have you noticed any change in the color of your urine? How often do you have to urinate? Do you have to wake up at night to urinate? Do you have any difficulty urinating? Do you feel that you haven't completely emptied your bladder after urination? Do you need to strain or push during urination? Have you noticed any weakness in your stream? Any dribbling of urine? Have you noticed any blood in your urine? For bowel symptoms, which is the next symptom that we'll talk about right now, has there been any change in your bowel movements? Do you have diarrhea? Are you constipated? How long have you had diarrhea or constipation? How many bowel movements do you have per day, per week? And what does your stool look like? What color is your stool? Is there any mucus or blood in it? Do you feel any pain when you have a bowel movement? Did you travel recently? In terms of weight, you can ask them, have you noticed any changes in your weight? How many pounds did you gain or lose? Over what period of time did it happen? Was the weight gain or loss intentional? For appetite, you can ask them, how is your appetite? Has there been any change in your appetite? For diet, you can ask them, has there been any change in your eating habits? What do you usually eat? What did you eat before the symptoms started? Are you on any special diet? I'm going to take a few minutes here to fix some technical problems. So we're talking about diet. The questions you can ask would be, has there been any change in your eating habits? What do you usually eat? Did you eat anything unusual lately? What did you eat before the symptoms started? Are you on any special diet? For sleep, you can ask, do you have any problems falling asleep? Do you have any problems staying asleep? Do you have any problems waking up? Do you feel refreshed when you wake up? Do you snore? Do you feel sleepy during the day? How many hours do you sleep? Do you take any pills to help you go to sleep? For dizziness, you can ask, do you feel dizzy? Do you ever feel dizzy? Tell me exactly what you mean by dizziness. That would be asking them to characterize that feeling of dizziness. Do you feel the room spinning around you, or do you feel lightheaded, as if you were as if you were going to pass out? Those are two different symptoms that you can ask the question about. Did you black out? Did you lose consciousness? Did you notice any change in your hearing? Do your ears ring? Do you feel nauseated? Did you vomit? What causes this dizziness to happen? What makes you feel better? Then joint pain will be the next symptom that you are gonna may have to ask the patient about. And you can ask, do you have any painful joints in your body? You can also ask, do you have pain in any of your joints? You can also ask, have you noticed any rash with your joints? Travel history might be a question that you might also have to ask the patient about, and you can ask them, have you traveled recently? Personal history, you can ask, have you had this problem or anything similar before? Have you had any other major illnesses before? Do you have any other medical problems? Have you been hospitalized before? Have you had any surgeries before? Have you had any accidents or injuries before? Have you are you taking any medications? Are you taking any over-the-counter drugs or herbs? Do you have any allergies? Then the family history would be another symptom that you might also have to ask the patient about. You can ask them, does anyone in your family have the same problems or anything similar? Are your parents alive? Are they in good health? What did your mother or father die of? Are your mothers or sisters alive? Are they in good health? For social history, you can also ask them some questions to be able to get an idea, an insight into their social history. Do you smoke? How many packs a day? How long have you smoked? Do you drink alcohol? What do you drink? How much do you drink per week? What do you drink? How much do you drink per week? Do you use any illegal drugs? Which ones do you use? How often do you use them? What type of work do you do? Where do you live? With whom? Tell me about your life at home. Are you married? Do you have children? Do you have a lot of stressful situations in your job? Are you exposed to environmental hazards on your job? For alcohol history, you can also ask them, how much alcohol do you drink? Tell me about your use of alcohol. Have you ever had a drinking problem? When was your last drink? If you suspect alcohol abuse, you can also ask them the CAGE questionnaire, which is have you ever felt a need to cut down on your drinking? Have you felt annoyed about criticism of your drinking? Have you ever had guilty feelings about your drinking? Have you ever needed to take an eye opener in the morning to wake up, or to get rid of a hangover, or to steady your nerves? For sexual history, you can also ask them some questions to get an idea into their sexual history, and this can be a very delicate part of the history taking process. And I normally like to ask that to initiate this session by telling them, Mr. A, I would like to ask you some questions about your sexual history. Is that okay with you? And if the patient says yes, that's okay, then I would now go ahead and ask them, are you sexually active? Do you use condoms always? Other contraceptives? Are you sexually active with men, women, or both? So that would be asking about sexual preference. Do you currently have one partner or more than one? Have you ever had a sexually transmitted disease? That would be asking them about their sexual history. Do you have any problems with sexual function? Do you have any problems with erections? Do you use any contraception? Have you ever been tested for human immunodeficiency virus? For the gynecologic obstetric history, you can ask them some questions to be able to elicit that part of the history. You can ask them, at what age did you have your first menstrual period? How often do you get your menstrual period? How long does it last? When was your last menstrual period? Have you noticed any change in your periods? Do you have cramps? How many pads or tampons do you use per day? Have you noticed any spotting between periods? Have you ever been pregnant? Do you have how many times? How many children do you have? Have you ever had a miscarriage or an abortion? In what trimester? Do you have any pain during intercourse? Do you have any vaginal discharge? Do you have any problems controlling your bladder? Have you ever had a pap smear before? Now, to ask questions about the pediatric history, you would want to ask, was your pregnancy full term, 40 weeks or 9 months? Do you did you have routine checkups during your pregnancy? How often? Did you have any complications during your pregnancy or during your delivery or after your delivery? Was an ultrasound performed during your pregnancy? Did you smoke, drink, or use drugs during your pregnancy? Was it a vaginal delivery or a C-section? Did your child have any medical problems after birth? In terms of growth and development, which is part of the pediatric history, you can ask, when did your child first smile? When did your child start crawling? When did your child start talking? When did your child start walking? And when did your child learn to dress himself? And when did your child learn to tie his shoes? And when did your child start using short sentences? And when did your child start putting things in his mouth? And when did your child have his first bowel movement? And when did your child become potty trained? For feeding history, you can ask questions about the pediatric feeding history. Did you breastfeed your child? When did your child start eating solid food? How is your child's appetite? Does your child have any allergies? Is your child's formula fortified with iron? Are you giving your child pediatric multivitamins? For routine care, you can ask, are your child's immunizations up to date? When was the date of your child's last routine checkup? Has your child had any serious illnesses? Is your child taking any medications? Has your child ever been hospitalized? For psychiatric history, you can ask some questions to elicit the components of the psychiatric history. Tell me about yourself and your future goals. How long have you been feeling unhappy, sad, anxious, confused? Do you have any idea what could be causing this? Yeah, would you like to share with me what made you feel this way? Would you like to, do you have any friends or family members you can talk to? Has your appetite changed recently? Has your weight changed recently? Tell me how you spend your time or day. Do you have any problems falling asleep, staying asleep, waking up? Has there been any change in your sleeping habits lately? What interests or hobbies do you have? Do you enjoy them? Do you take any interest or pleasure in your daily activities? Do you have any memory problems? Do you have any difficulty concentrating? Do you have any hope for the future? Do you think of killing yourself or putting an end to your own life? Do you have a plan to end your life? Would you mind telling me about it? And do you feel that you want to hurt other people? Have you ever done so? In patients who have suicidal ideations and who have a plan, you might actually have to admit them. In that case scenario, and then yeah, you can also ask them, do you ever see or hear things that others can't see or hear? Do you hold beliefs about yourself or the world that other people would find odd? Do you feel as if other people are trying to harm or control you? Has anyone in your family ever experienced depression? Has anyone in your family ever been diagnosed with a mental illness? Would you like to meet with a counselor to help you with your problems? Would you like to join a support group? What do you think makes you feel this way? Can you tell me more about it? Have you lost any interest in your social activities and relationships? Do you feel hopeless? Do you feel guilty about anything? How is your energy level? Can you still perform your daily functions or activities? Do you have any thoughts of harming yourself? Do you have any thoughts of harming others? Who do you live with? How do they react to your behavior? Do you have any problems in your job? How is your performance in your job? Have you had any recent emotional or financial problems? Have you had any recent traumatic events in your family? Does anyone support you? For daily activities for dementia patients, you can ask them, tell me about your day yesterday. Do you need any help bathing? Do you need any help getting dressed? What do you need help with when you're getting dressed? Do you need any help going to the toilet? Do you need any help transferring from your bed to the chair? Do you need any help? Do you ever have accidents with your urine or bowel movements? Do you ever not make it to the toilet on time? Do you need any help feeding yourself? What do you need help with when you eat? Do you need any help taking your medications, using the telephone, shopping, preparing food, cleaning your house, doing laundry, getting from place to place, managing money? For abuse, you can ask them, are you safe at home? Is there any threat to your personal safety at home or anywhere else? Does anyone, your husband, wife, parents, boyfriend, treat you in a way that hurts you or threatens to hurt you? Can you tell me about the bruises on your arm? Some mnemonics that have been helpful for eliciting these symptoms or for helping you to remember in your patient encounter in real life day-to-day patient encounter or doing simulated examinations would be Socrates. That's normally used for pain assessment, and S is for site, where is the pain or the maximal site of the pain. O is for onset, where did the pain start and was it sudden or gradual. Also include whether it's progressive or regressive, if it's getting better or if it's getting worse. Character, what is the pain like? Is it an ache or stabbing or pain? Radiation, does the pain radiate anywhere? Associations, are there any other signs or symptoms associated with the pain? Time course, does the pain follow any pattern? Exacerbating or relieving factors, that's the E. We talked about the S, the O, the C, the R, A, the T. So E will be exacerbating or relieving factors. Does anything change the pain? And then S will be severity, how bad is the pain? And then you can also ask about the complete review of system. There are 14 systems recognized by the Centers for Medicare and Medicaid Services. And the first one would be constitutional symptoms. which would include unexplained weight loss, night sweats, fatigue, malaise, lethargy, sleeping habits, appetite changes, fever, itch or rash, recent trauma, lumps, bumps, masses, unexplained falls. For eyes, it would include visual changes, headache, eye pain, double vision, scotomas, blind spots, floaters or feeling like a curtain got pulled down, retinal hemorrhage versus amaurosis fungi. For ears, nose, mouth, and throat, ENT, you can ask them about running nose, frequent nosebleeds or epistaxis, sinus pain, stuffy ears, ear pain, ringing in the ears, tinnitus, gingival bleeding, toothache, sore throat, pain with swallowing or odontophagia. For cardiovascular section, you can also ask them about chest pain, shortness of breath, exercise intolerance, PND, paroxysmal nocturnal dyspnea, atopnea, edema, palpitations, faintness, loss of consciousness, and claudication. For respiratory, you can also ask them about cough, sputum, wheeze, hemoptysis, shortness of breath, exercise intolerance. For gastrointestinal section, you can also ask them abdominal pain, unintentional weight loss, difficulty swallowing, solids versus liquids, indigestion, passing gas or obstipation, food avoidance, nausea or vomiting, diarrhea or constipation, and inability to pass gas, which is obstipation, vomiting, blood, which is also known as hematemesis, bright red blood per rectum, which is known as hematochezia, foul smelling dark black tarry stools, which is known as melena, and also dry heaves of the bowel, which is known as tenesmus. So to repeat the gastrointestinal section, it would be abdominal pain, unintentional weight loss, difficulty swallowing, that is solids versus liquids, indigestion, bloating, cramping, anorexia, food avoidance, nausea or vomiting, diarrhea or constipation, inability to pass gas, which is also known as obstipation, vomiting blood, which is known as hematemesis, bright red blood per rectum, and then which is also known as hematochezia, and then foul smelling dark black tarry stools, also known as melena, and then dry heaves of the bowel, which is also known as tenesmus. For the genitourinary symptom, for the urinary portion of the genitourinary symptom would be irritative versus obstructive symptoms. We could ask them about maturation, incontinence, dysuria, hematuria, naturia, polyuria, hesitancy, terminal dribbling, decreased force of stream. For genital, the vaginal section of that, you could ask them about any discharge, any pain. Also ask about their menses, the frequency, the regularity, whether it's heavy or light. Ask about the duration, about pain, about the first day of the last menstrual period, also known as LMP, gravida para abortus. That's how many times they've been pregnant. How many times they've had live delivery. How many abortions they've had. Also menarche, the first time they had a menstrual period. Menopause, contraception if relevant, the date of the last smear test and result. For the musculoskeletal section, you can also ask about pain, misalignment, stiffness, morning versus day long, whether it improves or worsens with activity. Ask about any joint swelling, decreased range of motion, crepitus, functional deficit, arthritis. For the integumentary section or the breast, you can also ask about pruritus, rashes, striae, lesions, wounds, incisions, acanthosis nigricans, nodules, tumors, eczemas, excessive dryness and or discoloration, breast pain, soreness, lumps, or discharge. For the neurological section, you can ask about special senses. Ask about any changes in their sight, smell, hearing, and taste. About seizures, about faints, fits, funny tongues. Headaches, about any pins and needles or paresthesia, or numbness, about limb weakness, poor balance, about speech problems, sphincter disturbance, higher mental function and psychiatric symptoms. For psychiatric section, you can ask about depression, sleep patterns, anxiety, difficulty concentrating, body image, work and school performance, paranoia, anhedonia, lack of energy, episodes of mania, episodic changes in personality, expansive personality, sexual or financial binges. For the endocrine section, you can ask about hypothyroid symptoms, if they prefer cold weather, if they have any mood swings, if they have if they are sweaty, if they have any diarrhea, if they have oligomenorrhea, if they have any weight loss despite increased appetite, tremor, palpitations, or visual disturbances. For the hypothyroid section, you can ask if they prefer hot weather, if they feel slow, if they feel tired, depressed, if they have thin air, if they have a croaky voice, if they have heavy periods, constipation, or dry skin. All these are symptoms of thyroid dysfunction. For diabetes, you can ask about symptoms that include polydipsia, polyuria, polyphagia, constant hunger without weight gain, which is actually more applicable for a type 1 diabetic than type 2. Symptoms of hypoglycemia such as dizziness, sweating, headache, hunger, and tongue disarticulation. For adrenal, you can ask about if they have difficult to treat hypertension, if they have chronic low blood pressure, if they have orthostatic symptoms, if they have darkening of skin in non-sun exposed areas. In the reproductive or the female area, you can ask about menarche, cycle duration and frequency, vaginal bleeding irregularities, use of birth control pills, changes in sexual arousal or libido. For the male reproductive system, you can ask about difficulty with erection or sexual arousal, depression, lack of stamina or energy. For the hematological and lymphatic section, you can ask about anemia, purpura, petechia, results from routine hemolytic disease screening, prolonged or excessive bleeding after dental extraction or inquiry or injury, use of anticoagulants and antiplatelet drugs including aspirin, family history of hemophilia, history of a blood transfusion, and whether they refuse blood donation. So to repeat the hematologic or lymphatic section, you would ask about anemia, purpura, petechia, the result from routine hemolytic diseases, screening, prolonged or excessive bleeding after dental extraction or injury, use of anticoagulants and antiplatelet drugs including aspirin, family history of hemophilia, history of a blood transfusion and whether they refused blood donation in the past. For the allergic or immunologic section, you can ask about difficulty breathing or choking or anaphylaxis as a result of exposure to anything, and asked about the specific allergen, which could be nickel, copper, or food allergens. You can ask about swelling or pain at the groin, axilla, or neck. If they have any swollen lymph nodes or glands, if they've noticed that. If they also have any allergic response to materials, food, animals, if they have reaction to bee sting, if they also have any unusual sneezing and what causes it. Asked about runny nose, or itchy or teary eyes. Asked about reactions to food medications, and that would be the last section. Of the review of system, and this can be asked of the patient in a head-to-toe manner. Then next thing that we'll talk about will be the differential diagnosis of these symptoms. So for pain, it could be cardiac in origin, it could be myocardial infarction, it could be pericarditis, it could be from the central nervous system. It could be a headache, it could be a headache due to migraine or cluster headaches. It could be gastrointestinal, like cholecystitis or appendicitis. It could be medications or toxins. It could be metabolic, like abdominal pain due to diabetic ketoacidosis. It could be psychiatric. It could be chronic pain. It could be trauma. It could be musculoskeletal. From the reproductive system. So that's 10 differentials. For nausea and vomiting, it could be due to pregnancy. It could be metabolic. It could be psychiatric. It could be migraines. It could be malignancy. It could be central nervous system. It could be gastrointestinal or malignancy, or due to infectious etiology. For cough, it could be due to sinusitis. It could be bronchitis. It could be emphysema, it could be pulmonary embolism, it could be asthma, it could be influenza, it could be group A streptococcal pharyngitis, it could be due to pulmonary embolism, it could be due to sarcoidosis, it could be congestive heart failure. For headache, it could be due to an intracranial tumor, it could be subarachnoid hemorrhage, it could be tension headache, it could be due to a seizure, it could be migraines, it could be cluster headaches, it could be viral meningitis. It could be cerebral aneurysm, it could be dissection syndrome, it could be viral meningitis, it could be temporal arthritis. For fever, it could be actinomyces, it could be cholecystitis, it could be candidiasis, it could be chronic lymphocytic leukemia. It could be human immunodeficiency virus, it could be brucellosis. It could be fever of unknown origin. It could be influenza. It could be pulmonary tuberculosis. For shortness of breath, it could be due to sinusitis. It could be due to bronchitis. It could be due to emphysema. It could be due to pulmonary embolism. It could be due to asthma, influenza, group A streptococcal pharyngitis. Or it could be due to pulmonary embolism. It could be due to sarcoidosis, and we're talking about shortness of breath. It could be due to congestive heart failure. For the urinary symptoms, it could be due to cystitis. It could be bladder cancer. It could be herpes simplex. It could be pelvic inflammatory disease. It could be vaginitis, urethritis, acute pyelonephritis, cervicitis. Or prostatitis. For bowel symptoms, it could be due to constipation, it could be toxic megacolon, it could be colon adenocarcinoma, it could be Chagas disease, it could be diverticulitis, it could be diverticulosis, it could be irritable bowel syndrome, ugly syndrome, ileus, or thyroid dysfunction. For weight, appetite, and diet changes, it could be due to achalasia, it could be due to bulimia nervosa, it could be due to malignancy, anorexia, constipation, protein losing enteropathy, malabsorption, chronic mesenteric ischemia, thyroid dysfunction, panhypothyroidism. For sleep changes, it could be due to jet lag, it could be due to thyroid dysfunction, it could be due to primary insomnia, It could be medication induced, it could be depression, it could be obstructive sleep apnea, it could be due to restless leg syndrome, it could be due to shift work dysfunction, it could be due to congestive heart failure or obstructive sleep apnea. For these areas, it could be due to benign positional vertigo, Meniere's disease, migraines, vestibular neuronitis, schwannoma, labyrinthitis, syphilis, malignancies, psychiatric symptoms of transverse myelitis. For joint pain, it could be due to rheumatoid arthritis, osteoarthritis, septic arthritis, Lyme's disease, osteomyelitis, ischemic necrosis, gout, pseudogout, sarcoidosis, and psoriatic arthritis. For travel history, some conditions you should think about, even as you're eliciting the symptoms of the travel history from the patient, would be leprosy, leishmaniasis, erythema nodosum, cat scratch disease, tularemia, blastomycosis, Rocky Mountain fever disease, erythema nodosum, and hepatitis A. So now we'll go into the physical examination, for the general survey, the first thing to do would be to observe the general state of health, height, build, and sexual development. Note the posture, the gait, the motor activity, and the dress, the clothing, any others of the body of breath. That's according to Bates. Also note facial expressions and note manner of affect and reactions to persons and things in the environment. Note the patient's manner of speaking and note the state of awareness, signs of distress, and the level of consciousness. Note the patient's skin color and obvious lesion. So, these are some things that would stand up to you even as to do the general survey, with the components of the general survey. For the head, ears, nose, and throat examination, so some ways you can be able to initiate that would be, to say some things to the patients, and it's very important to be able to get permission before you perform the physical examination. So some things to say to the patient before and during the exam would be, I need to examine your sinuses, so I'm going to press on your forehead and cheeks. Please tell me if you feel pain anywhere. I would like to examine your eyes now. I would like to shine this light in your eyes. Can you please look at the clock on the wall? I need to examine your ears now. Can you please open your mouth? I need to check the inside of your mouth and your throat. What to perform during the head, ear, eye, nose, and throat examination. For the head, you can inspect the head for signs of trauma and scars and hair distribution. Palpate the head for tenderness or abnormalities. For the eyes, inspect the sclera and conjunctiva for color and irritation. Check the pupil for symmetry and reactivity to light. Check the extraocular movements of the eyes. Check visual acuity with the Snellen eye chart. Perform a phonoscopic exam. And the rule for that is right. That's the ophthalmoscope should be in the examiner's right hand, and also you should examine the patient's right eye. And also, I'm using your right eye. And then for the left, it's also left. So the ophthalmoscope should be in the examiner's left hand, and also using your left eye and examining the patient's left eye. For the ears, conduct an external ear inspection for disjoint, for skin changes or masses. Palpate the external ear for pain, which is normally an indicator for otitis externa, and then also do the same for the mastoid process. And then also examine the ear canal and the tympanic membrane using an otoscope. It's very important to use the new speculum for the patient, and then conduct the Rhine and the Weber tests. The Rhine test, I'm going to tell you a little bit about that. It's performed by placing a low frequency 512 Hz vibrating tuning fork against the patient's mastoid bone and asking the patient to tell you when the sound is no longer heard. So once the signal that they can't hear it anymore, then you now position the vibrating fork was 2 cm from the auditory canal, then ask the patient if they can be able to hear the tuning fork. So for normal hearing, air conduction should be greater than bone conduction. So the patient should be able to hear the tuning fork next to the pinna after they can no longer hear it when placed against the mastoid process. For abnormal hearing, if they are not able to hear the tuning fork after the mastoid test, then it means that their bone conduction is greater than their air conduction. That means that there's something inhibiting the passage of sound waves from the ear canal through the middle ear apparatus and into the cochlea. So that's conductive hearing loss. In sensory neural hearing loss, the ability to sense the tuning fork by both bone and ear conduction is equally diminished. So implying that they will hear the tuning fork by ear conduction after they can no longer hear it through the bone conduction. So this is actually similar to what is found in patients with normal hearing, but in patients with sensory neural hearing loss, they will indicate that the sound actually stops earlier. So that's the results for the Rhine and Weber test. Now, for the to be specific about the Weber test, in the normal patients, the Weber tuning fork is heard equally loud in both ears, with no one ear hearing the sound louder than the other. So that's lateralization. So a patient with symmetric hearing loss will hear the Weber tuning fork sound equally as well, with diagnostic utility only in asymmetric or one-sided hearing loss. In patients with hearing loss, the Weber tuning fork is heard louder in one ear, which is lateralization versus the other, and that's the result of the Weber test. Now, for the nose, you can tell the patient, you can tell the patient that you want to inspect their nose. Tell them, I want to inspect your nose now. So now you can now say, now I'll go ahead and inspect the nose, palpate the nose and the sinuses, inspect the nasal tubulates and the nasal septum with a light source. For the mouth and throat, you can inspect with a light, and tooth tapping will be performed if indicated. For the cardiovascular examination, what to say to the patient before and during the exam, you can tell them, I need to listen to your heart. Can you hold your breath, please? Can you sit, please? Can you turn to your left side, please? I'm going to examine your legs to check for fluid retention. Is that okay with you? I need to check the pulse in your arms and legs now. So what to perform during the cardiovascular examination? It's advisable that you do not lift the patient's gown when examining the heart. That's actually for modesty reasons. In examinations, it's indicated that you do not do that. But rather just put the gown down the shoulder and expose only the area to be examined. So, and then you can now listen to the carotids for bruit. Use the bell of the stethoscope. Look for JVD. Palpate the chest for the point of maximal impulse. And then check for retrosternal heave and trills. Listen to at least 2 of the 4 cardiac areas. And then it's advisable to listen to the mitral area with the patient on the left side. Listening to the base of the heart with the patient leaning forward. Check for pedial edema and also check the peripheral pulses. For the pulmonary exam, what do you say to the patient before the pulmonary exam? Well, I need to listen to your lungs now. Can you take a deep breath for me? Can you say 99 for me, please? I'm going to tap on your back to check your lungs. Is that okay with you? So what do you perform during the pulmonary examination? Well, examine the front and the back of the chest. Don't percuss or auscultate through the patient's gown. Don't percuss or auscultate over the scapula. Allow a full inspiration and expiration in each area of the chest. And also inspect the shape of the chest. And inspect the respiratory pattern. Check for deformities and then palpate. So and palpate for tenderness and tactile infirmities. and then PCOS. And then go ahead to auscultate and also check for go funny. For the abdominal exam, what is the patient, for the abdominal exam? Well, what I need to examine your belly or stomach now. I'm going to listen to your belly now. I'm going to press on your belly now. Tell me if you feel any pain or discomfort. Now I need to tap on your belly. Do you feel any pain when I press in or when I let go? Which hurts more? That's checking for rebound tenderness. And then what to perform during the abdominal examination, while you inspect and you auscultate. It's always advisable to auscultate before you palpate, so that you can be able to hear the normal bowel sounds. Palpation actually elicits some false bowel sounds. And then you now palpate, and it's always advisable to start from the area that is further away from the site of the pain. If they have a pain in the right epigastric area, you can start from away from that area, and also be gentle on the painful area and don't try to re-elicit the pain. So if you press on that area and the patient says that they have a pain, then do not palpate on that area again. And then also check for rebound tenderness. Asking them, does it hurt if I press against this area? Hurt more if I push in or if I push out. So that's checking for rebound tenderness. Then for CVA tenderness, that's also part of the abdominal exam, and you do that by placing your hand against the back of the patient, and then using one hand to pound on the back and also check for pain with that maneuver. That's indicative of renal dysfunction. And then also for the obturator sign, that's a specialized sign, the Sowat sign, and then the Murphy sign. All that's checking for appendicitis and for cholecystitis. We'll talk about that when we talk about case studies for cholecystitis later on. Then also check the liver span, and we'll talk more about that later on. And then the neurologic exam. So what do you say to the patient during the neurologic examination? Well, you can ask them, I would like to ask you some questions to test your orientation. I would like to check your memory and concentration by asking you some questions. Can you tell me your name and age? Do you know where you are now? Do you know what the date is today? Then I'll show the patient your pen and say, do you know what this is? Now I would like to ask you some questions to check your memory. I will name 3 objects for you, and I want you to repeat them immediately. Okay? Chair, bed, and pen. That tests immediate memory. So I will now ask you to repeat the names of these 3 objects after a few minutes. That tests short-term memory. Then do you remember what you had for lunch yesterday? That tests recent memory. When did you get married? That tests distance memory. Now, can you repeat for me the names of the 3 objects that I mentioned to you? That tests for short-term memory. So you would ask them to repeat those 3 objects for you, and that's a test for short-term memory. Are you left-handed or right-handed? I'll give you I'll give you a piece of paper. I want you to take the paper in your right hand, fold the paper in half, and put it on the floor. So that's for a test for 3-step command. Now I want you to write your name on the paper. I want you to count backwards, starting with the number 100. Or ask them to take 7 away from 100 and tell me what number you get, and then keep taking 7 until I ask you to stop. So that tests concentration. Now, then the next question would be, what would you do if you saw a fire coming out from a paper basket? That tests judgment. Now, what this is to the patient during the exam, the neurologic exam questions, you can tell them, I'm going to check your reflexes now. I'm going to test the strength of your muscles now. This is up, this is down. Tell me which direction I'm moving your big toe. Can you walk across the room for me, please? So what do you perform during the neurologic examination? That's the section that we are at right now. So for the mental status examination, testing for orientation, memory, and concentration. For the cranial nerves, for cranial nerve 1, that's not often tested. For 2, that's vision. You can use the Snelling test. Then for 3, 4, and 6 is tested for extraocular movement. You can ask them to follow your hands. We'll talk about that more extensively. For 5, you would test for facial sensation and muscles of mastication. For 7, you would ask them to smile, lift their eyebrows, and close their eyes and don't let you open them. That's a testing for the facial nerve. And then for 9 and 10, that will be testing for symmetric palate movement for the gag reflex. For 11, ask the patient to shrug their shoulders. For 12, ask them to stick out their tongue. For the motor system, you will test for passive motion. So for active motion, for the arms, you could ask them to pull in. That's testing for flexion. You ask them to push out. That's testing for extension. For the wrist, you could ask them to push down. That's testing for flexion. For extension, you can ask them to pull out. For the hands, you can ask them to spread their fingers apart and close their fists. For the legs, knee extension, you can ask them to kick out, also knee flexion, ask them to pull in. For the ankles, ask them to push on the gas. For the reflexes, you can check the biceps, the triceps, the brachioradialis, the patella, Achilles, Bobinski. Then for the sensory system, you can check check to differentiate between sharp and dull using a pin and also cotton swab, and also check for vibration position sense. For cerebellum, you can do a finger to nose, heel to shin, rapid alternating movements, the Rombeck sign, and also check for gait. For meningeal signs, check for neck stiffness, Kennings and Brzezinski. So for the Kenning sign, it's positive when the thigh is bent at the hip and the knee at 90 degrees angle, and subsequent extension in the knee with pain felt by the patient. And this may actually indicate subarachnoid hemorrhage or meningitis. For the Brzezinski sign, this is when there is an involuntary lifting of the legs when lifting the patient's head of the table. So for the joint exam, that's where we are right now. What do you say to the patient when examining the joint? Well, ask the patient, tell me if you feel any pain anywhere. I'm going to examine your knee or ankle now. Then what do you perform during the joint exam? Well, you inspect and compare the joints with the opposite side. You palpate and also check for joint effusion, check for crepitus, and then also check the joint range of motion. We'll talk more about this physical examination maneuvers in more detail with improved media integration later on this show. And then for the E&M physical examination, the 1997 E&M guidelines recognize the following organ systems. There are 15 of them. So for the constitutional, that includes 3 vital signs and also the general appearance that we talked about earlier on. For the eyes, that includes inspection of the conjunctiva and lids, examination of the pupils and the iris, and then also ophthalmoscopic disc and posterior segments. For the eyes, yeah, that's for the eyes. Then for the ears, nose, mouth, and throat. Well, you have external appearance of the ears and nose. So you check for the overall appearance for scars, lesion, and masses. For otoscopic examination of the external auditory canal and tympanic membrane. Assessment of hearing is also very important. Inspection of nasal mucosa, septum, and turbinates, and then also inspection of the nasal of the lips, the teeth, and the gums. Then also examination of the oropharynx and the oral mucosa, salivary glands, hard and soft palate, tongue, tonsils, and posterior pharynx. Then for the neck, examination of the neck, that's examining for the overall appearance, checking for masses, checking for symmetry, and for the tracheal position, and checking for crepitus. And then also examination of the thyroid. For the respiratory system, it includes assessment of the respiratory effort. You check for intercostal retractions, use of accessory muscles, diaphragmatic movement. Then also you percuss the chest, checking for dullness, for flatness, for hyper-resonance. Then also palpation of the chest is also very important, checking for tactile fremitus, and then also auscultation of the lungs. We'll talk about that more in detail. For the cardiovascular section, palpation of the heart, that's at all the locations. Also checking the point of maximal impulse for the size, also checking for trills. Then auscultate the heart, and then also note any abnormal heart murmurs or abnormal heart sounds. And then also assess the lower extremities for edema and varicosities. Then also examine the carotid arteries, check for pulse amplitude, and also check for breathe. Then also examine the abdominal aorta, check for size and breathe. Then also examine the femoral arteries, check the pulse amplitude and the breathe. And then also examine the pedal pulses, checking the pulse amplitude. For the chest, that includes inspection of the breast, checking for symmetry and nipple discharge, and also palpation of the breast and the axilla to check for any masses. For the gastrointestinal system or the abdomen, that includes an examination of the abdomen with notation of presence of the masses or tenderness, examination of the liver and the spleen, examination for the presence or absence of hernias, and then examination of the anus, perineum, and rectum, including sphincter tone, presence of the hemorrhoids, rectal masses, and also obtained a stool for occult blood testing when needed. For the genitourinary system for the male, that includes an examination of the scrotal contents, example for checking for hydrocele, for spermatocele, for tenderness of the cord, for testicular mass, also examination of the penis. Then also doing a digital rectal examination of the prostate gland, checking for size, for symmetry, for nodularity, and also for tenderness. For the female genitourinary system, you want to do a pelvic examination with or without specimen collection for smears and cultures, which may include examination of the external genitalia, example the general appearance, hair distribution, lesions, examination of the urethra, that is checking for masses, tenderness, and scarring, examination of the bladder, checking for fullness, masses, and thickness, and then also examination of the cervix, checking for the general appearance, for any discharge or any lesions, and then also examination of the uterus, checking for the size, the contour, the position, the mobility, tenderness, consistency, descent or support. And also examination of the adnexa or parametra, checking for masses, tenderness, organomegaly, and nodularity. For the lymphatic system, that includes palpation of lymph nodes in 2 or more areas, so checking the neck, the axilla, the groin, and other lymph nodes. For the musculoskeletal, examination of the gaits and station, inspection and palpation of digits and nails, example clubbing, cyanosis, inflammatory conditions, petechia, ischemia, infection, and nodes. And then also the examination of the joints, bones, and muscles includes the following 6 areas. So you have the head and the neck, spine, ribs, and pelvis, right upper extremity, left upper extremity, right lower extremity, and left lower extremity. This examination of any of these given areas mentioned above would include inspection and palpation with notation of the presence of any misalignments, asymmetry, or crepitation, checking for defects, tenderness, masses, or infusions, assessment of range of motion with notation of any pain, crepitation, or contracture. Then also assessment of stability with a notation of any dislocation, subluxation, or laxity. Assessment of muscle strength and tone, which includes flaccid, cogwheel, spastic notation of any atrophy of normal movements. For the skin, that would include inspection of the skin and subcutaneous tissue, example rashes, lesions, and ulcers. Palpation of the skin and subcutaneous tissue, example induration, subcutaneous nodules, and also checking for tightening. For the neurologic system, that would include testing the cranial nerves with notation of any deficits, examination of deep tendon reflexes with notation of any pathologic reflexes, example Babinski, which we just talked about a few minutes ago. Then also examination of sensation, example touch, pain, vibration, and proprioception. Then for the psychiatry, that will include a description of the patient's judgment and insight, a brief assessment of mental status, which will include orientation to time, place, and person, recent and remote memory, mood, and affect. So with that concludes the physical examination. We talked about the physical examination, and also the 15 systems recognized by the E&M guidelines. So we'll talk about healthcare news right now. And so from healthcare news from the White House and from public health, the registration for the Center for Disease Control and Prevention upcoming advisory committee on immunization practices with dates February 25th to 26th, 2015 is open. The American College of Physicians, the primary regional conference is scheduled November 19th to 20th, 2014. Please endeavor to register. For the American Academy of Family Physicians, report to your assembly and CME by November 21. Make it easy to claim your credit and take advantage of the special assembly reporting site by November 21. From the American Psychiatric Association, APA is hosting its next hashtag your MS Twitter bird and Twitter track on smoking cessation in observance of the American Cancer Society's Great American Smoke Out. Join the conversation on Thursday, November 20th from noon to 1 p.m. Eastern Time. To join, use the hashtag YourMH, which stands for Your Mental Health, or at APA Healthy Minds. You can learn more at the website. American Pediatric Association, practical pediatric CME courses start next. Is scheduled for San Antonio, Texas, December 5th to 7th, 2014. Toolkit for Climate Change and the Affordable Care Act. So I would like to thank you for collaborating with Dr. Chikito Mentrip in this educational global Ustream YouTube show with show times 8 a.m. and 3 p.m. And I want to invite you to continue to collaborate with us, and wish you a wonderful rest of the day and every day.